for sure. Talking about Obamacare and what it's done for our family. My wife and I have had insurance through our employers for over 20 years, and we, for 18 of those years, we paid about $200 a month for our premium. In the last 3.5 so years, our premium's gone up about 50%. We pay over about $350 to $400 a pay period for our health insurance, and our deductible used to be $250 a year, and now it's over $1,000 a year. And at my wife's work, Windstream Communications, their healthcare, they've decided to pretty much buy a plan that is forcing their employees to go to the exchange. They have a $4,000 deductible. Their premiums are $900 a month, and the company said, you can either buy this or you can go to the exchange. And so a lot of her co-workers were complaining, and so they now buy through Farm Bureau because we have a plan that they can purchase. And so personally, it has affected us just because our premiums have gone up, our deductibles have gone up, and we feel like that it's not a workable plan, and we're looking forward to something new. So that's what's happening. I think it's because of there was a group of folks who wanted to get control of 1/6 of the economy in the United States, and that's what the healthcare industry is, 1/6 of our economy, and they have gotten control of it. Anytime the government touches something, it usually doesn't work out very well. So anyway, we feel like that we're looking forward to a change.
Obamacare has made the medical field and the availability of care for patients more difficult because more people have access to health care. The introduction of Obamacare helped many people afford health care and is a great opportunity for people to improve their health. It lowers patients' medical costs to a more reasonable number. When I first became a nurse and started my first job in geriatrics, all I thought of was how much better I would feel knowing that the residents were in direct care of someone who genuinely worries about them. But from a nursing perspective, Obamacare doesn't compensate for nurses based on their performance and the volume of nurse-to-patient ratios. As a nurse at a nursing home, there have been times where I was responsible for 40+ people at a time. But in a way, I think I enjoy it. If I want to work as a nurse for the elderly with access to things like Obamacare, I'll have to get used to the hectic life of treating multiple people at a time. But I wouldn't have it any other way.
So my take on Obamacare is that I have a lot of clients, although I don't sell health insurance, I have a lot of clients who share with me that they are not able to get the medical care that they need due to the high deductibles on their insurance plan. They tend not to go to the doctor, so they might need some back issues, or they may have feet issues or health, maybe diabetes or something, and they can't get the medicines and the care that they're looking for because they haven't met their deductible for the year. But yet they're paying $900, $800, $700 a month for their premiums, and things have to change for the middle class.
Okay, my opinion on this Obamacare, since it came into effect, we pay insurance on our 2 employees, which are my sons, and before the Obamacare came into effect, insurance on one son, my youngest, Jace, was around $260, $270 a month. Justin and Rebecca was around $300. Now we're paying $1,200 a month, $600 each, and I understand this year it's even going higher when our policy renews. So I have some real issues. We're a very small business. We can't take that very much longer.
I've not been